Osteoporosis or porous bone. Osteoporosis, otherwise known as fragile bone disease, is a chronic, progressive metabolic bone disease characterized by low bone mass and structural deterioration of bone tissue, leading to increased bone fragility. So, in osteoporosis, it's a progressive metabolic bone disease. Here, there will be low bone mass and structural deterioration of bone that leads to bone fragility or increased chance of fracture. Osteoporosis are common in women than men, 8 times common in women than men. We can see what is the reason for that. Women have less bone mass because of the generally smaller frame. Most of the women, as compared with men, they are smaller frame, so the bone mass will be low. Next reason is bone resorption begins at an earlier age in women and it is accelerated at menopause. So after menopause, the estrogen level will be low. That's why the osteoporosis level will be increased after menopause. Another reason is pregnancy and breastfeeding deplete a woman's skeletal reserve unless calcium intake is adequate. So, usually during the time of pregnancy and lactation, we are taking the calcium tablets. If we are not take adequate calcium tablets, what happens is our skeletal reserve will be depleted and will be contributed or will be given to the child through breastfeed. So our calcium reserve in the bone will be lost. So that is the another reason for women are mostly get this osteoporosis. Next reason is women have high tendency to take lower calcium intake because they give their food or they are not giving importance to the food. Okay, they are always giving to the children and husband. So the woman, they are taking less food as compared with men, so they are getting high chance to get this osteoporosis, their tendency to get lower intake of calcium. Next one, longevity increases the likelihood of osteoporosis. If the age increases, the chance of osteoporosis is high. So these all are the reasons women are get high chance to get this disease. Okay. Now we can see what is the risk factors of osteoporosis. So as said earlier, there is a mnemonics for osteoporosis, that is axis get osteoporosis. So A means alcohol use and advanced age. Next one, C, corticosteroid use, that is long term corticosteroid use may a reason for osteoporosis. Then calcium low, that is diet low in calcium, an increased risk for osteoporosis. Then estrogen low, that is after menopause our estrogen level will be low, and in case of men testosterone will be low, so that also a reason for osteoporosis in men, but in women estrogen low will be a reason. Then smoking habits, then sedentary lifestyle, all this may cause the risk factor for osteoporosis. Then one more thing, that is history of anorexia nervosa or bulimia. They are not taking adequate food. Okay, so that is the reason. Then chronic liver disease, then malabsorption syndrome, excess caffeine use. This also a risk for osteoporosis. The pathophysiology of osteoporosis. The etiological factors like calcium and vitamin D deficiency, menopausal bone loss, age or genetic history or hereditary causes, then diet low in calcium or other factors leads to decreased bone mass or bone quality. So when there is decreased bone mass, the increased chance to get bone fragility. That's why there will be fracture and trauma will be occurs. That is the pathophysiology of osteoporosis. Now we can see the signs and symptoms of osteoporosis. Osteoporosis is often called a silent disease because bone loss occurs without symptoms. So most of the cases it is asymptomatic. People may not know they are having osteoporosis until their bone becomes so weak or fracture occurs. Then some features they may show is high close because increased chance of kyphosis. Okay. Then back pains, the prolonged pain, back pain is a risk for osteoporosis. Then stooped posture, then bone fractures without major trauma, then bone or joint pain. These all are the common signs and symptoms we can see in osteoporosis, but usually it is asymptomatic. Diagnosis of osteoporosis is done by history and physical examination. Then assessment of serum calcium, phosphorus, alkaline phosphatase and vitamin D level give a clear picture of our bone. Then bone mineral densiometry, then dual energy X-ray absorptiometry or DEXA, then quantitative ultrasound, all are helpful for diagnosing osteoporosis. Then DEXA is the confirmatory test for osteoporosis. So in this picture you can see the X-ray of osteoporosis. So in normal X-ray you can see the bone density is good and it is specifically the bone is correctly defined and bone density is good. But in osteopenia means between normal bone and osteoporotic bone there is a stage that is known as osteopenia. Here bone mineral density will be 1 to 2.5. Then in osteoporotic stage the bone density is highly decreased. So that is happening in this picture. Here also we can clearly identified how the bone density is losing. In the first picture the bone density is very good, but in the second picture, the osteopenic picture, the bone density is decreasing. Then in osteoporotic X-ray the bone density is highly decreased. So that is the difference in while we are observing the X-ray. The assessment of bone mineral density is very useful to diagnose osteoporosis. The normal bone health, that is T-score between -1 to +1. In case of osteopenia, the T-score will be -1 to -2.5. Then osteoporosis, the T-score will be -2.5 to -4. So that is the bone mineral density assessment. So based on the score, we are getting the osteoporosis is diagnosed. The management of osteoporosis, the first one, biphosphonates. Biphosphonates inhibit osteoclast-mediated bone resorption, thereby increasing bone mineral density and total bone mass. This group of drugs has been shown to increase BMD by 5%. The drugs are alendronate, risedronate and ibandronate. Alendronate can be given 10 mg per day or 70 mg per week orally. Or risedronate can be given 5 mg per day or 35 mg per week orally. Next one, zoledronic acid 5 mg intravenously every 12 months. Then raloxifene 60 mg per day orally. Next one, estrogen receptors, selective estrogen receptor modulator such as raloxifene. These drugs mimic the effect of estrogen on bone by reducing bone resorption without stimulating the tissues of the breast or uterus. The raloxifene is postmenopausal women significantly increase BMD. Next one, calcitonin. Calcitonin is secreted by thyroid gland and inhibits osteoclastic bone resorption by directly interacting with the osteoclast. When calcitonin is used, calcium supplementation is necessary to prevent secondary hyperparathyroidism. Next drug is anabolic, that is teriparatide. It is used for the treatment of osteoporosis in men and postmenopausal women who are high risk of having fracture. Teriparatide is a portion of human parathyroid hormone and works by increasing action of osteoblast. Then vitamin D supplementation. Then the diet that is rich in calcium. Then smoking cessation, all these are helpful for management of osteoporosis. Osteoporosis can be prevented by exercise regularly, and in case of postmenopausal women, increase the calcium intake up to 1000 mg per day. That will help for the woman to reduce the risk of osteoporosis. Then adequate dietary intake of calcium, magnesium, vitamin K, etc. So here the person has to take milk, yogurt, turnip greens, cheese, ice cream, sardine, spinach, etc. That will help to increase the calcium levels. Then normal weight maintenance, then no smoking, alcoholic habits, then enjoyment of sunshine in the moderate level, that also improve the vitamin D.